On today's episode, the medical director of Tough Mudder, Dr. Stuart Weiss.
This is the world's toughest podcast. Welcome to the world's toughest podcast, where we talk about any obstacle course race you'd like, as long as that's world's toughest mudder. Each week we talk to members of the WTM community and share stories of success and failure in the single greatest event in OCR. My name is Will Hicks, and this is the world's toughest podcast.
Welcome back to World's Toughest Podcast. My name is Will Hicks. Thank you for listening. We are barraging you with information and interviews and everything you need to know for World's Toughest Mudder this weekend. Today on our show, Dr. Stuart Weiss. Dr. Weiss is the medical director for Tough Mudder, the worldwide medical director for Tough Mudder. He is also the medical commissioner for World OCR, which is the International Obstacle Course Racing Federation that is working on bringing the sport of OCR to large multinational sporting events that occur every 4 years or so. In addition to that, he is the medical director for the TCS New York City Marathon. So Dr. Weiss, to the best of my knowledge, has never sat down for an interview like this before. Very excited, very honored to have Dr. Weiss, the medical director of Tough Mudder Worldwide, on our show today. Before we start, you can email me at willhicks@gmail.com. You can follow me on Twitter at @TheWillHicks, and you can follow the show on Instagram at World's Toughest Podcast. If you are following along this weekend on World's Toughest Mudder, if you're at home and trying to watch the race, you can watch Tough Mudder's Facebook Live page, and you can watch World's Toughest Podcast on Instagram. Between those two sources, we will have you covered. Obviously, Tough Mudder is Tough Mudder. We are not official or unofficial subsidiary of Tough Mudder, but between them and us, we will have you covered for World's Toughest Mudder content this weekend. If you'd like to be a part of the show, you can leave a review on Apple Podcasts. Tap the purple podcast button on your iPhone or iPad. Search for World's Toughest Podcast. Scroll down and click Write a Review, and I will read it on a future episode. I sincerely appreciate the reviews. And last thing, if you would like to win a free, I'll tell you about the prize in a second, but you should email me at worldstoughestpodcast@gmail.com with So Smart WTM in the subject line. Pick the winners. Pick first, second, and third place. Tell me which man and which woman are going to finish in each of those 6 positions. If you get all 6 of them correct, you will win a brand new, 100% totally free World's Toughest Podcast sticker. And I will call you on air to congratulate you on your prize. That's World's Toughest Podcast @gmail.com with So Smart WTM in the subject line. It's time to talk with Dr. Stuart Weiss. Let's go to the phones. Dr. Stuart Weiss, thanks for joining the show.
Hey, I'm really excited to be here, Will. It's going to be a great World's Toughest Mudder coming up.
Dr. Weiss, you were telling me your voice is a little sore this morning. You were doing a lot of briefings this past week?
Yeah, so I'm going to sound a little bit like a croaking bullfrog, I'm afraid. I am, in addition to being the global medical director for Tough Mudder, I'm also the medical director for the TCS New York City Marathon, which just was a few days ago. And I had to do multiple briefings for my 2,200 medical staff, and then I was in race command the whole day. So my voice is a little shot, but we'll do the best we can today.
I heard that the TCS New York City Marathon is the largest marathon in the world.
It is. We are the largest marathon in the world, running through the 5 boroughs of New York City. As I mentioned, we have over 2,000 medical volunteers from all the major hospitals in the tri-state area, and we take care of all the runners that have issues. And it was very successful, and lots and lots of finishers, and it was great running weather, perfect running weather, mid-50s, and a nice, beautiful day.
Before we get to World's Toughest Mudder, you're also the medical commissioner for World OCR. Tell me about that.
I am. So several of us have gotten together. We want to elevate the sport of obstacle course racing to the level of I'm not allowed to use a certain word, but you can imagine a multi-country, multi-sport event that happens every 4 years. We want to elevate the obstacle course racing to that level.
The O word we're talking about.
Yes, the O word. We're not allowed to say the O word. It's just a rule of the O committee. But we are working very hard to bring obstacle course racing up to that international standard.
So we're talking about World's Toughest Mudder. World's Toughest Mudder is coming up just a few days from today. You are the medical director for Tough Mudder.
I am. As you can tell, I wear many hats. I'm very excited about the 2018 World's Toughest Mudder, which, as you know, is in a new venue in Atlanta. So and we're right outside of Atlanta. We're very excited about this new venue. And I think we're going to see some really amazing athletes performing the way they do.
What does the medical director do? What does your job entail?
Okay. So my job is to make sure that severalfold. One, before the obstacles are ever built, I am part of the Global Safety Committee for Tough Mudder, and we take a really hard look at the obstacles and the way they're constructed and try to minimize the risks to athletes. So we take Tough Mudder is really dedicated to making sure that the obstacles are as safe as possible. So I do that beforehand, working together with my colleagues at Tough Mudder. And then during the event, I'm responsible for organizing all of the care that occurs on site for the event. So my team organizes the doctors and the nurses and the medical staff on the field, and our job is to make sure that we have a really safe event.
What's the most common injury at World's Toughest Mudder?
Well, there's several, right? So in Atlanta at night, it's going to be cold. And I want to make sure that the athletes understand that. It's going to be cold at night there. And so overnight, we see a lot of cold people that come. And one of the things that's really good about the way it's set up is at night, the athletes will know that they have to have a medical check every time they do a loop. And the medical tent is heated. And if the athletes want to come in and spend a few minutes in the medical tent getting warmed up before they go out for another loop, they can certainly do that. As you know, they can spend up to 29 minutes in the medical tent and then go out and continue running. We try and push you out before the limit because after 30 minutes, if you're in the medical tent, you're disqualified. So people can come in for 15 minutes and warm up. And so overnight, being cold is something that we see a lot of. Other things that we see are orthopedic-related sprains and strains and things like that. And sometimes some overuse injuries from people that are working their upper bodies really hard and perhaps haven't trained that much or they're coming off an injury. So lots of orthopedic stuff related to the environment. And then on day number 2, it's related to how hard the athletes have pushed themselves and how well they have kept themselves hydrated and refueled. So remember, if they're exercising for hours and hours, they need to take in calories and they need to take in fluids. And the athletes that we see on the second day that come into medical, it's because they haven't really taken good care of their body. It takes a really special type of training to be able to do an endurance event over many, many hours. And the athletes that do well keep themselves fueled and hydrated.
You mentioned the cold. I feel like we've been beating the drum for a while, but I think a lot of people are going to be surprised how cold it is this year in Atlanta.
Yeah, at night it gets down. Well, I'm not a meteorologist, but we're planning for it to be in the 40s or high 30s this year. So it gets really cold. Athletes need to wear wetsuits, and they need to take care of themselves and realize when they're getting cold, they should come in and warm up a little bit. It's going to be cold at night. And that adds a level of stress to our athletes. Even last year and the year before, when we had this out west in Las Vegas, it got cold in the desert at night. But I think Atlanta, it's going to be even colder.
What is the number one thing an athlete should do to prevent injury or reduce the risk of injury at World's Toughest?
Well, I always like to talk to the athletes before they come to a World's Toughest Mudder to make sure that they've trained adequately. So two things is training and stretching, right? So you want to make sure that you're limber, that your muscles are able to function adequately and at their maximum efficiency, and also they need to train properly. Remember that doing obstacle course racing is both, well, what makes it so interesting and so challenging, it's upper body, it's lower body, and it's endurance. So it is like running the TCS New York City Marathon plus doing all the obstacles. So, it's a combination of both endurance training and upper and lower body training. I think obstacle course racing is really exciting because it pushes athletes in ways that perhaps other sports don't, because you have the combination of both endurance training plus the upper and lower body strength.
So this year at World's Toughest, it looks like there's going to be an electric lane or basically an option to take 3 electric obstacles in a row to minimize penalties on another route. Some people, Tough Mudder's had electric obstacles for years, but a lot of people still look at them and they say there's no way that's safe. What's your thought on the electric obstacles?
Well, I'm not going to comment on the course features because some of them are surprises and I don't want to give it away here. But I can tell you that we have extensively taken a look at the electric obstacles. We take a look at it. I took a look at it very deeply when we first introduced them several years ago, and we continue to review that data. There are many safety protocols in place in conjunction with the electric obstacles, and the current and voltage that we use are consistent with many things that are used in law enforcement, for example, and it's been deemed safe. We've had many people go through our electric obstacles, and the safety profile is a very good one. So although it looks scary, and we put electric obstacles in to increase the mental push on athletes, I can tell you that it is physiologically a safe obstacle.
It's still crazy, though, right?
I'm not saying it's not a little crazy, and I'm not saying it doesn't zap you a bit, but I can tell you from the medical standpoint that it has a really good safety profile.
You mentioned being involved in the development process. What does that look like when they're developing a new obstacle and they want to make sure it's safe or safe enough to bring on a course?
Yeah.
What does that look like?
So, yeah, absolutely. One of the things that I'm very proud of at Tough Mudder is the work that gets done when an obstacle is being developed. So people may, and luckily they don't need to know what happens behind the scenes because they're the athletes and they're out there performing on our obstacles. But what I can tell you is there's a fairly robust process where the obstacle designs are presented, then they're discussed, then they go back and there's an alpha test that's done with a few select people, and we take a look at that data, and then there's a beta test done with a larger pool of people. And so before an obstacle gets rolled out to the general public, it has gone through several rounds of testing where we're looking at how do people interact with it? What are the unintended interactions that we haven't planned for? What are the intended interactions? And we take a look at all that data. And then during the actual use of an obstacle, during an event, we watch for injury trends. We watch for things happening so that we can keep the event as safe as possible. One of the things that we all know in the obstacle course racing world is that injuries do happen because athletes, as in any sport, when athletes are pushing themselves very hard, it is possible to get injured. But my job as the medical director is to try and minimize the amount of injuries by doing our homework beforehand.
I'm sure Tough Mudder wants tough obstacles and maybe scary obstacles, but how do you determine where that line is? People can get hurt on almost anything. Well,
the idea of reviewing the obstacles very clearly before they're rolled out, I think that is the best way to balance the the obstacles that challenge people mentally and physically. Obstacles have several different types of challenging, right? There's the mental side of an obstacle, and then there's the physical side, and then the course is designed to test the endurance side of an athlete. So there's multiple different ways that athletes are pushed, and the idea is to find a balance between, in those obstacles that are testing an athlete's mental grit, to find a balance between how tough is the obstacle and safety. And I think Tough Mudder finds a really good balance between the ones that look really scary, but in fact have some safety factors built into it.
Do you have a favorite obstacle that you had input in?
I really enjoyed, several of them. I really like, when I'm on course, I like watching people go through electric shock therapy because I love watching the way they strategize to get through it. Like and watching the difference between men and women when they try and figure out how to go through it. That's fun. I like watching that because people, you can see some people go really fast as a group, and some people sort of go slowly between the wires, and some of them stand there planning and strategizing, and then you have groups of people. So I really enjoy watching electric shock therapy when it's on course. I enjoyed King of the Swingers as well. I had a lot of input into that. I think there's some new obstacles at the World's Toughest this year that are really interesting and exciting. And so I like a lot of them, many of the obstacles.
It's funny watching people try and sneak through electroshock therapy because they might make it like 5 feet, but then one wire gets the back of their leg, so they jerk forward, and then they get more in the front, and they jerk back.
Yes. And, I can tell you, I have touched the wires myself. I have felt what it feels like. And again, we've done all the studies. So it's fun to watch people go through it. But I understand what it feels like when people get zapped.
This year...
Break for a second.
Sure.
Are you hearing my phone beep?
I'm not, no.
Oh, okay. Sorry, it says call waiting is happening.
No.
Okay, can we pick up?
Yeah, absolutely.
Let's pick up.
So this year at World's Toughest, what's the plan for the pre-race safety briefing?
So the safety briefing happens. The safety briefing is performed by the race director. So it'll be the race director. Before they go up and do the safety briefing, there's a conversation with the medical staff to make sure that they outline any specific risks that they want covered in the safety briefing. But it'll be similar to previous years. The medical director will get up and brief the athletes on any hazards, on any special considerations they need about the course, some of the rules, and just some ways to keep themselves hydrated and warm, similar to and well-fueled, similar to what I've talked about with you today, Will.
We talked about how cold it's going to be. Every year, people show up, or people ask the question beforehand, do I really need a wetsuit? How should runners approach the warmth and preventing hypothermia?
So my suggestion is this year, based on the weather that we're seeing, my answer is yes, you really need a wetsuit. You will be running through the night if you're planning on running at night. Even in the day, it's going to be a little chilly, but certainly it's going to get much colder once the sun sets. So people that are wet and running and outside for a long time will absolutely become hypothermic through the night if they're not wearing adequate protection. So I would say that this year, people that are coming to compete for the whole event and compete through the night should definitely bring a wetsuit. No question about it.
Talking about competing through the night, overnight, before each runner begins a new lap, they have to get checked by medical before they start that lap. What is the medical team checking for?
We want to make sure that the athlete still has the mental wherewithal to safely do the obstacles. So we are looking to make sure that the athletes are thinking properly and can adequately judge risks. So it's not a big check. Most of the time, it's just a matter of the medical staff asking the athlete a question or two and getting a coherent answer. When people start to get very hypothermic or dehydrated or other medical situations, they get confused and they may not answer the questions properly. And then we'll pull them into the medical tent for a further check, which again does not disqualify the athlete. We just want to make sure that the athlete's okay. Now, if in fact we find that there's some issues, then we may have them stay there for a few minutes and warm up or do whatever is required. But for those athletes that are doing fine, the medical team will ask them a question or two. They'll be seeing how the answer is to the questions. And if it looks to the medical team that the athletes are coherent and able to, interact with the obstacles in a safe way, then off they go. So the nighttime check is just to make sure that the athletes are safe. And again, it's our whole idea is to keep this a fun, challenging event, but also have a layer of safety over it.
Some people worry about if they fail that neuro check or that check overnight, if they fail that check, that they're disqualified from the race. But if they're not disqualified from the race, they just can't start that lap right away.
That's correct. And sometimes they can come into the medical tent and warm up a little bit, and then they're fine. Sometimes if they're not okay, then the medical team will say, well, we don't want you to continue because it's not safe. It's all based on safety, right? We will have to make sure that an athlete is thinking correctly because the obstacles are challenging. And if an athlete is not able to adequately think about how they're going to interact with an obstacle and do it safely, then it's our mission to make sure that the athlete doesn't start another loop where they could hurt themselves very badly, right? So if an athlete has the wherewithal and is thinking properly and wants to do another lap, then they just need to answer the questions properly and give this medical staff an idea that they are able to adequately perform the tasks that are in front of them.
And they're not hard questions. They're like, what state are you in?
Yeah, it's a simple, right. It's not like we don't ask you to calculate the square root of pi or something, some difficult math thing. We just ask you a couple of simple questions that you should be able to answer. And they'll vary it because we don't want people just saying the same thing over and over again. But the idea is there's certain questions that medical folks will ask patients in general, not athletes specifically, but to judge whether a patient is alert and oriented and thinking properly. So the medical staff's job is to quickly, and they also take a look at the athlete. If an athlete were to show up at the medical checking and they were, blue and violently shivering and, wobbly, we would want them to come to the medical tent. So it's a combination of looking at the athlete and asking them a couple of questions, and then if everything's great, off they go.
You mentioned that 30-minute time limit earlier. Can you just clarify how much medical attention can someone get at World's Toughest without being disqualified?
So basically, the idea is if the patient needs IV hydration, so they can't tolerate orally rehydrating themselves. So if they're sick enough where they require IV hydration, or they're sick enough where they require medical interventions that are further, that take longer than 30 minutes, or they're sick enough where we think it is a danger to them to let them go out, then we will disqualify them. If an athlete just wants to stop in to get a check of something, or wants to warm up a little bit, or it's a simple kind of medical problem that we can take care of, relatively quickly, then they can continue. The medical team is there to assist the athletes, right? We have two jobs. One, patch them up and get them back on the course because we want athletes to compete. That's why they're there. That's why we're there. So we want the athletes to compete. But our second job is to make sure that they are safe and can come back and compete another time. So we don't want athletes to get really seriously injured. And so we are there to make sure that an athlete is in good enough shape to do another lap.
You mentioned hydration. What do you recommend for athletes for hydration? What would you do if you were running the race?
Yeah, so what we tell endurance athletes, and the same thing we told athletes at the marathon, for example, the other day, is drink when they're thirsty, right? So your thirst mechanism, as long as you're not terribly hypothermic, but the thirst mechanism is a good way of judging. So if an athlete is thirsty, they should drink fluids. And, that's the way of understanding, that's the best way to understand how their body is doing. Their urine should be light yellow in color if they can, if you look at their urine. If their urine is really dark, like concentrated apple juice color, that means they're not getting enough fluids. But they should the urine in a well-hydrated athlete should be sort of a lightish yellow, like very dilute-looking, not pure white because that's overhydration, but pure clear, that's overhydration, but slightly yellow, light-colored urine is perfect. So we always tell athletes, a combination of drinking when you're thirsty and keeping an eye on your urine, and that's the best way to keep track of that their hydration is good.
What about pain medication? What do you recommend for World's Toughest with pain medication?
Generally, as in regards to pain, we recommend, we try to have people avoid taking Motrin or Advil or other non-steroidal anti-inflammatories. And that's a general recommendation for endurance races if people are doing miles and miles and miles, because there is a theoretical risk of some medical conditions that can happen with the kidneys if people take Motrin. Now, if they do a couple of laps and then all of a sudden they get hurt, and they want to take Motrin, that's fine. But for the endurance athletes that are going, laps and laps and laps and running, I usually say running more than 6 to 8 miles, then I would recommend Tylenol, and no more than every 6 hours Tylenol. But I would recommend Tylenol only and try to avoid Motrin or Advil or ibuprofen or one of those non-steroidals.
Since World's Toughest is 24 hours long, the course changes over the course of the race. What should an athlete do if the safety of an obstacle is deteriorating over time, like mulch being worn down or water levels dropping?
And that's a great question. There is a Tough Mudder operations team that's out there throughout the days and the night that are watching very closely the obstacles and looking for changes. Our medical team is out there as well looking for changes in the obstacle. But if an athlete finds something that they think should be brought to the attention of a race official, then they just need to find a race official. And that can be the medic at the obstacle who has a radio, or it can be anybody in course operations. All those folks have radios and have a way of communicating with the central race operations folks, and they can bring it to the attention. We encourage athletes to let us know if they see something. We may already know that there's an issue there, and the course team may be out on their way over there to fix it. But if they discover something in an obstacle, or even while they're running through the woods on the course, they notice something, they should just bring it to our attention. And we'd be grateful, and then we'll send somebody out to take a look.
World's Toughest is going to be a few weeks after the regular Tough Mudder in Atlanta. Is there anything done to the water? Is the water treated at all between the two events?
That's a great question as well. We are always concerned about the safety of the water, and we have various protocols in place to assess the water quality and to make sure that the water is safe for athletes to get into. I'm not going to go into detail right now about the specific obstacles because various protocols that are done based on the water source and where the obstacle actually is. So I can tell you that the course operations team is very aware of water safety, and they are doing the things that need to happen to make sure that the water is safe.
What about after the race is over? What should a runner be aware of for their health? The race is over. They think they're safe at home. Maybe what could happen maybe a day or two later? Is there anything to be aware of?
Yeah, we always tell the athletes to keep track of their bodies, right? Because several things can happen. So if an athlete has pushed themselves really, really hard, one of the things that we always worry about is an abnormal breakdown of muscle tissue called rhabdomyolysis. And so if an athlete a day or two later, if their soreness is getting much worse, or the urine is turning really dark colored, sort of dark reddish, orangey, dark colored, they need to see a doctor. So that's one of the things I always warn athletes that are running many miles. We always worry about this medical item called rhabdomyolysis. The other thing that I always like to tell athletes, specifically in obstacle course racing, is they are interacting with their environment and they are interacting with water obstacles. And if they were to develop some type of gastrointestinal problem, from having interacted with the water obstacles, for example, then we want them to let their doctor know. So if an athlete gets home and 2 or 3 days later they're developing vomiting or diarrhea, then if it's just once or twice, then that could be whatever they have. But if it's a prolonged course of vomiting or diarrhea, then they should notify their local doctor and talk to their local doctor and perhaps go in and have them looked at. If they have abdominal pain along with the vomiting and diarrhea, then that's something that should be taken care of pretty quickly. So we worry about, I as a medical director always worry about, complications in endurance athletes from performing over many hours and going long distances. So I always worry about that. And then because of the unique nature of obstacle course racing, interacting with land, crawling through mud, going into water obstacles, we always worry about waterborne illnesses as well.
If you could talk to every athlete running World's Toughest Mudder and tell them one thing about safety, or maybe two things about safety, what would you tell them?
I would want to reach out to the athletes to say several things. I would say, first, use your judgment and listen to your body. Right? We find the athletes get injured when they're really tired and they're pushing themselves, but they're ignoring an injury or they're ignoring something in their body, and then they try and do interact with an obstacle, and then they get injured. So I would say listen to your body and pay attention to how it's doing from the musculoskeletal side. And also listen to their body when it comes to fueling it with food and calories and also hydration. Remember, if as an athlete you're feeling lightheaded or dizzy or you're feeling very thirsty, then it's time to start drinking fluids or taking in some more calories. Those are the kind of things that I would tell any endurance athlete, is to listen to your body when you're pushing yourself. Hopefully athletes have trained for this event. They understand the mechanics of their bodies, and they understand how they perform in long-term endurance events, and athletes should remember that as they're performing.
What else should people know about Tough Mudder Medical or World's Toughest Medical?
We're there. The medical team is out there to support the athletes. I know that there have been some folks, as you mentioned earlier, that have been concerned, if I interact with medical, I'm going to be disqualified or something bad's going to happen. I want to just reiterate to folks that medical is there to support you, that we are there to help get you back on the course. We want to get you back to compete. We're here to help warm you up or patch you up or do whatever we need to do. All of us that are working love obstacle course racing, and we want to see all of our athletes perform. We will advise you if we think that you're not physically or mentally capable of continuing. And there are, as we talked about, there are some times when we will take action on behalf of our athletes to make sure that the athletes that can't interact safely with our obstacles are taken care of. But as long as athletes understand that medical is here to support them, we can work together to make sure that the World's Toughest Mudder in a couple of days is a wonderful, safe event.
Dr. Weiss, this part of the show, or this part of the interview, I usually ask my guests if they have any sponsors or anything they'd like to plug. Is there anything else, anything maybe not Tough Mudder related you want to endorse or talk about?
Yeah, thanks for asking, Will. The only thing I'd love to tell people is that, we are part of the medical team through Intelligent Crowd Solutions. That's my company, and through that, I have the privilege of serving as the medical director for multiple events around the country. If any of your listeners happen to be medical folks and they want to get involved with delivering care to athletes, I would love folks to join our medical team. We're in multiple states around the country serving many different types of events, from America's Cup racing on the water to endurance events to obstacle courses to triathlons, all over the place. So they should go to icrowd.com, which is the website for Intelligent Crowd Solutions, and we'd be happy to hear from them. And they can join our medical team. iCrowd also provides other type of event services, so they can go take a look at what we do and join our team.
Dr. Weiss, any last thoughts on a World's Toughest Mudder?
I would just want to tell folks, have a great time. Know that the medical team is there to support them, and best of luck to the folks that push themselves at this wonderful event.
Dr. Stuart Weiss, thanks much.
Thank you for inviting me, Will.
Special thanks to Dr. Stuart Weiss for appearing in this episode. Well done, Dr. Weiss. Come back anytime. Also, special thanks to Molly Kenneth for setting up this interview. Molly was instrumental. It would not have happened without her, and Molly, thank you very much. If you would like to hear more from Molly, you should go to theocrreport.com and read Molly's latest article on hypothermia. It is outstanding. Also look forward to an episode with Molly between now and World's Toughest Mudder. It's almost here. I will see you then. Go spend time with someone you love.